it's something you don't go back to once you feel that good. Unless they truly seek it out, I think it's hard to change people's minds about what truly is health. You start with one pill and then you have another one and then another one. And I don't know about you, but I don't like sitting in doctor's offices and wasting my time doing that. I want to enjoy life. Hopefully, lots of people will just start believing in their own health.
So Joleen Lake, you are a advanced practice nurse that has been working with Revero now for some time. Thank you for doing the interview, and then also thank you for being part of our Revero. What we're trying to do, I think, is pretty cool, and glad to have likewise clinicians that see the same thing. Where are you located? Do you mind sharing that?
Sure, I'm in Fort Myers, Florida.
Fort Myers. Okay. You guys got whacked by a tornado a little while ago, if I'm not mistaken, or a hurricane back last year, right? Correct?
It's been crazy. Yeah, the weather's been insane around here.
Yeah. I know it's a pretty part of the country. I was just in Fort Lauderdale a couple weeks ago. Humid this time of year.
Yes, very.
That's for sure. I like being up in Washington State in the summer because it's pretty cool. It's only about,
Absolutely.
I
I love my age.
Yeah. Well, tell me, how did you get into clinical care in the first place? What drove you into that from the beginning?
Sure. I always wanted to be a nurse. And when the time came, I thought, this is really what I want to do. I want to help people. When I became a nurse, I got into oncology nursing, which I thought was a great way to do that. I felt like these patients are very sick. They really need someone good to take care of them. And I learned so much. I learned so much about nursing and the medical profession then. And then I took some time off with my sons when they were born. And when I got back into it, I started teaching at a college, and that was a little more conducive to being a mother as well. And I was able to go back to school to be a nurse practitioner. And I just really felt like that was the way to go. And I was really happy to get into that line of work as well. My first job was working at an OBGYN clinic, and I felt like so many women were coming in feeling tired and not feeling well, not sleeping, depressed, and I couldn't quite put my finger on why. And it kind of led me to down the hormone path, and I educated myself, and that's really what got me into root cause medicine, because being bioidentical and learning about that form of replacing those hormones really was interesting to me. And I felt like, wow, I'm really doing a great job for these patients. And during those studies, I learned so much more about root cause medicine and diet and how important that is, and reversing insulin resistance, because it's really becoming such a problem as we age. So that's really how I got into it. And I love that part of it. And people in that conference area that I go to every year just are really into the diet and exercise and all of that. So it's great.
Yeah, kind of food as medicine, lifestyle as medicine. It makes a huge difference. And
It does.
unfortunately, medicine has sort of almost dismissed it as kind of like, well, you can kind of do it, but it doesn't really work that well. And we have these powerful medicines, and they're going to make a bigger difference. Marty Macri is now the FDA chair. I don't know if you saw, and he has been really talking about, and I interviewed Marty, I don't know, about 6 months ago, I think, before he became the FDA commissioner. And his one of his passionate topics, and he's talking about that now, I've noticed, is hormone replacement in women, because there was a limbo period from, I want to say, about 20 years where it was kind of like, maybe this is going to lead to increased risk of breast cancer versus what's happening with the bones and things like that, And so a lot of women were discouraged from, replacing hormones. And I think some of that still exists today in some cases. So it's interesting to see that discussion kind of circle back to what it was before. And many people feel that the bioidenticals are better than the synthetic versions. I don't know enough about it personally to really be have any expertise on that. But let me ask you, oncology is interesting because you look at it and it's like, well, it's a noble cause because so many people suffer with cancer, and it can be a very horrifying disease to get. And, the treatment is it can be kind of brutal. I mean, chemotherapy, radiation, the surgical procedures, typically those are the main treatments. And yet we don't really see much in the way of cancers being cured. I mean, I don't know that we just, we've been pushing about it. We've been donating and wearing pink ribbons for 40 or 50 years, having our
Right.
cupcake and bake sales to support women's breast cancer. And it doesn't go down. The rates don't go down. And there's no real sort of cures. I mean, you might be I think most of the, correct me if I'm wrong on this, but I mean, most of the things may prolong someone's life a few months, but it doesn't really do much to cure. I mean, occasionally you hear people that are cancer free and so on and so forth, which is great. But it's a very lucrative part of medicine. Most people don't realize that these oncology infusion centers make a lot of money. I mean, they're very, very lucrative. But let me ask you how you said you like the sort of the root cause medicine. So a lot of women that were just suffering from fatigue, perimenopause, dysmenorrhea,
Mhm.
messed up menstrual cycles, obesity, all the things that we see so commonly, which we attribute to aging and that stuff. How did you get interested in like I said, Revero, we're almost exclusively about root cause medicine. In fact, that's pretty much all we focus on. I mean, obviously we're still prescribing, deprescribing medications when indicated, but mostly deprescribing. How did you get what put you on what we're doing here at Revero, I guess?
Yeah, it was interesting. I really got into it because I started doing way back Atkins, I guess you would call it, but I wasn't doing it right. I was eating bars and drinking shakes and all the things we do to try to lose weight. It was after I had my children, and it worked. I exercised a lot. I felt better. I lost the weight, but now I realize, wow, those were not the things to eat. And that's the great thing about Revero is we have coaches that help you through and tell you don't eat those things, eat real food. They guide you in the right amount of things you should eat, such as the right amount of protein, the right amount of fat, and making sure you get all those things in your diet. And they tailor it to every patient. Not everybody is going to be full carnivore. Not everybody is going to do well on keto, and they really help you figure out what it is in your diet that's limiting your results and maybe not making you feel as well. But it's so rewarding to see patients come off their medications, and that's really what drew me to Revero. Way back, a friend of mine told me when I was doing keto, you can just eat meat. And I thought, wow, really? And she pointed me to your social media, and that's really what got me interested in it. So it's amazing to really just eat, what our ancestors ate and feel good and put our body in the right environment to heal itself.
Yeah, I mean, certainly something to that, and I think regardless of what our ancestors eat, we don't really know. I mean, it's hard. I mean, we can't. We don't have a
Yeah.
time machine. I mean, there's clues, and I mean, certainly we ate a lot of meat, and whether we did it exclusively for a long period of time, for a short period of time, in some geographic locations or not, I mean, I think some of that exists for sure. But undoubtedly, in 2025, when people eat a bunch of meat, they get healthier. I mean, that
Hmm.
is clear as day. And the fact that we've been sort of demonizing it for in excess of 50 years, I think has been tremendously harmful to vast swaths of the population. Starting to undo that is really cool. How long have you been with us now? How long have you been doing this stuff for?
Just since the beginning of the year.
Beginning of the year. So we're in I guess I guess tomorrow's August 1st. So about 7-8 months.
Right.
What have you seen? What do you typically see as far as type of patients and what has been the sort of experience so far?
So far, a lot of prediabetes, diabetes, which in my opinion is kind of the same thing.
Mm-hmm.
It's just kind of how far they've gotten with it. Hypertension, GERD, and even some skin disorders, eczema, itchy skin, some pain in the extremities, things like that.
Okay. So a lot, and there's no shortage of people that are pre-diabetic in this country.
Right.
I
Right.
saw a statistic a while back, and it said the average American's hemoglobin A1C is pre-diabetic. So talking 5.8, 5.9, 6.1,
Mhm.
6.0, something. That's the average American, which is really kind of terrifying to think about it, because what that leads to is, and we see it, and I think I saw another stat recently that fully 1/3 of our teenagers are not pre-diabetic, which is also
Yes.
shocking, incredibly, disturbing to think about that. So, I mean, one of the things that I will tell you, going back, 15 years ago when I was still practicing full time in orthopedics, and I was starting to wake up to some of this metabolic lifestyle and how it could impact even orthopedic conditions. I found that I had no resources for these people. I mean, I was like, hey, go read this book. Hey, go watch this video. And that's the best I could do, particularly given the limited time I had. And now, as you know, with Revero, you've got a lot of resources for the patients. You've got all kinds of educational materials. First of all, you got physicians who are actually dedicated to doing lifestyle, not doing it as a, oh, by the way, type of thing, like I was trying to do as an orthopedic surgeon. And then, of course, you got an entire team that works for these folks, sometimes on a daily basis. So it's got to be nice. Correct me if I'm wrong on that, for that purpose.
Absolutely. There's so much support. And I can't say enough about the health coaches that talk to the patients daily, and they're so quick to respond when patients have questions or concerns or just need a little cheerleading in their corner, and they're just fantastic. And then the other nurse practitioners and physicians that I work with are so quick to respond if you have a question, and we collaborate and help each other. So it's just a great positive environment, which I really love that. And a workplace where you have that positivity and can work together to really help people in a really good way is just so wonderful to be a part of.
Yeah, I mean, you talk about the rapidity of response. I mean, I did an interview the other day with one of our other providers. He's out in Alabama, and he said, look, I got an alert that one of our patients had a pretty high blood pressure episode, and within 24 hours, we were making adjustments. And so,
oh yeah,
that is not something you typically see in primary care because so you get these visits once every 6 months, once every 3 months, and so you don't get to see all that data that you guys have access to. Sometimes daily metrics, weekly metrics, which, you go to the doctor and you get your blood pressure checked, when you go to the doctor's office once every 3 months and,
right.
or even less frequently. So it's hard to respond to that stuff. Do you, so as far as the patient, here's the interesting thing. I would say when, again, back when I was practicing orthopedics, when patients came to see me, they didn't want to be there. There's nobody that wants to go to the orthopedic surgeon because it means you broke your ankle, your knees got arthritis. Maybe it's like, oh, I can finally end my suffering, but most people don't want to be there. I think in contrast, do you feel that the patients that you have to deal with now are motivated and want to do this stuff?
Yes, they are so motivated. I'm really impressed by the number of them that come to Revero already trying to eat keto, carnivore. They just need that extra attention and push so they can become fully on that diet, and then they are monitored. So it's so cool to see their blood pressure slowly go down, the trends, their blood sugars slowly go down over time, and they're able to get off of those medications. So that's what's really awesome to see, and their labs improve over time. I love that.
Do you so what is typically the time frame that you see people start making changes? Where you can see tangible improvements in whatever measurement we're looking, whether it's weight loss, blood pressure, glycemic control, general subjective stuff. How often, how rapidly do you see stuff like that?
It's really impressive. As far as blood pressure, that improves very quickly because of the water loss you get initially with starting that type of diet. And then, so the blood pressure improves drastically, I think. The blood sugar can take a little time, but you see the downward trend, and that's very encouraging. As far as other things, I think most people just need to give it a little time, but it does improve, and it's really nice to see.
Yeah, absolutely. I mean, blood, and this is one of the things when you're treating blood pressure, and I don't know how much you did in your previous, or you still do, because I think you probably still maybe practice within the women's health space. I think most people treat blood pressure with a series of interventions, typically some sort of medication, whether it's a diuretic or a beta blocker or an ACE inhibitor or a calcium channel, the list goes on and on. There's so many of them now.
Mm-hmm.
Angiotensin receptor binding medication, all these meds that have come out over the years, and we just never take people off these. I mean, we switch them around. We don't typically see them sort of just getting better. And then we tell people to avoid salt, which also is maybe not the best advice in my mind. What what has been some of the more surprising things you've seen happen since changing your own diet personally, or what you see with patients? Hey folks, it's Dr. Shawn Baker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
Just with myself, the way I feel, I'm so impressed with my own heartburn went away, and just the feeling of energy and sleep improved so much. It's incredible to feel those changes and look back and say, oh wow, this is all diet. GI stuff, especially, after dropping the vegetables, I really can't tell you how much that really makes your stomach feel better, and you don't feel bloaty, and it's something you don't go back to once you feel that good. So it can be contagious eating this way. So you just always feel good. I love it.
Yeah, and it's interesting, because it's almost considered heresy to somehow say you don't need vegetables, or vegetables may be problematic for people because they've got this sort of American Heart Association seal of approval around them, so to speak. I mean, they kind of label it as we should eat mostly vegetables. Quite honestly, that's what a lot of people believe, and yet, particularly, you mentioned reflux, gastroesophageal reflux disease, which I see over and over again get better when people remove vegetables for the diet for whatever reason. I think it's due to just the fermentation that's occurring in the gas that's being produced, leading to excessive pressure in the gut. But obviously, as someone who's been in healthcare for a number of years, first as a nurse, and then as an advanced practice nurse, and you probably had some conception of what a healthy diet was. Is that fair to say? And it probably featured lots of salads, vegetables. Correct me if I'm wrong on that.
Yes. I think, over the years, especially as a woman, you think I have to eat a salad, or, eat some seafood, and, that's the healthy diet. But I have no problem with a good ribeye all the time. I think that's really the best way to get all your nutrition in. And I think some of my friends are starting to follow suit, and they understand. And I see them, preparing food the way I do. So I think it's fun to see people around me kind of joining in. I love that. I think if we talk about it long enough, it will continue to catch on.
Yeah, and what is it's certainly spreading. I assume, you're still probably doing your day job, I suppose. Is that, are you still working in the women's health space, and you do, Revero as sort of more of a part-time thing, which many of our providers do, by the way. Does your experience at Revero now impact the rest of your day-to-day job? I mean, obviously it's you probably see patients, you're like, wow, you could really use some help with what you're doing. Is that a fair statement?
Absolutely. I would say most women come in and talk about, oh, I need to lose weight. I think it's a hormone problem. And my line always is, well, it is a hormone problem. It's your insulin. And I try to tell them, you need to check this company out. It's fantastic. They will help you. They will guide you every step of the way. So it's always a topic that comes up every single day.
Yeah, I mean, I can remember going back to, like I said, when I first started, thinking about like, oh my gosh, nutrition could help a lot of these patients. And I thought I would just like hand a few flyers out a couple times a day. Every once in a while you get a patient there. I thought it would be beneficial. And I remember my nurse, her name was Karen, wonderful nurse. And I said, Karen, can you like make a couple flyers for me to hand out for my patients? And I would ask you. And then within about a month, I was going through 40 or 50 of them a day. It's just like, yeah, you can use this. I just kept seeing it. Everybody could use it. It's so common, particularly in the doctor's office, because, well, who's in the doctor's office? Sick people. Why are they sick? Most of the time, it has to do with part of their lifestyle, their diet and nutrition, sleep, and all those other things. And so all of a sudden you're like, yeah, everybody could use this stuff. And so, particularly if you're sick, and that's what, where, healthcare is designed to interact with. We call it sick care in many ways because it's a whole bunch of sick people and we just disease manage them. Here's a pill, take this for the rest of your life and good luck to you. And if that doesn't work, we'll give you a different pill. So I don't know, the set, because obviously with Revero, it's digital. So you practice probably from home or, office or wherever you at where it's convenient. A lot of providers just like it. It's just like, it's convenient. I like it. I'm happy. The patients are actually getting better. It's a fun experience. Do you have, like, at your other job, do you have people that you interact with on a regular basis, other docs, other practitioners, nurse practice that this stuff type comes up?
Oh, for sure. We always talk about diet, and lunch is always the topic at work, and it's always funny that they will look in the fridge to see what everybody brought, and mine's always the steak with the butter on top, so they know that that's mine and to stay away. But we always try to collaborate and help people and talk about what's best for diet and lifestyle choices and things like that. But the best thing about Revero is everybody's really on the same page, and I love being around people who are like-minded and always, are trying to help people really heal through that.
Yeah, and I think that, because a lot of people people listening saying, well, they're considering Revero. I mean, I think most people, the way we work differently than other companies or other medical things is, you go to the doctor, your primary care physician the rest of your life, maybe he's going to prescribe your pills for the next 10, 20, 30 years, and you just kind of go into that disease management model. And our goal is a little different. We're looking at getting people healthy, fixing them, having them lose weight, get off meds, and then they're gone. And we don't need to do anything more because we've kind of fixed that. And it's kind of different from the disease management model. I remember when I first heard the term disease management, I think it was somewhere, I don't know, late 90s or something like that. And you're like, what does disease management mean? And then it quickly became apparent. It means, we chronically medicate people for the rest of their lives, which is a very good financial model. I mean, this is why all the drugs that are being developed these days, almost all of them are designed to be taken for the rest of your life. Like how many Stelara and Skyrizi and all these autoimmune, suppressant drugs, which are designed to be taken for the rest of your life, you see on TV now. It's all those ads. You're bombarded with these, take this for the rest of your life type of stuff, which is, where's all the effort into, the cures? And we're going to cure you from this disease. And it doesn't exist. There's no incentive for that. And I think the pharmaceutical companies know that and have no desire to even pretend to do that stuff. Like the cure for cancer, they're like, why would we cure cancer when we can just medicate people with it? All right. Well, let me ask you, have you, who are the more, I guess, the more challenging patients that you have to deal with either in your own practice or through Revero?
I think it's hard to change the way people think about diet, and even if you talk about lower your carbs, eat more meat, eat a little more fat, it's just hard because they're getting a different message from their primary doctor, they're getting a different message from friends and even TV and all those ways that they get their information. So unless they truly seek it out, I think it's hard to change people's minds about what truly is health, because there's a lot of opinions out there. So I just think the more we do, I think healthcare is hopefully on the brink of changing a little bit. I think there's enough people out there that do enjoy this lifestyle and put it out there on social media and podcasts and things like this. So hopefully lots of people will just start believing in their own health and wanting to do better for themselves rather than just take a pill. Because like you said, with cancer is a scary disease, and things like that, you start with one pill and then you have another one and then another one. And I don't know about you, but I don't like sitting in doctor's offices and wasting my time doing that. I want to enjoy life and retirement eventually and be healthy. So
Yeah, absolutely. It's one of those things where, I think it's something that a lot of patients when they're diagnosed with some chronic disease, whether it's an autoimmune disease or diabetes or even obesity, I mean, they often feel really disempowered because the answer often is, um, we don't know why this occurred in many cases, particularly like autoimmune diseases, or and we'll say that we don't know why you have this, but we do know that we can put you on these medicines for the rest of your life and tamp down the symptoms, I guess, is a more sort of politically correct way to say that, when we're just putting bandage on. And the patient loses a lot of agency in their fate. I mean, they become dependent on the system and they don't know why. And it's very, I think it's very disempowering for them. And then when you say, wait a minute, no, there's a reason for this, and it's something that you have the power to modify, and you might need some support and some people will help you figure these things out. That is a much better solution. It's empowering rather than disempowering, because disempowering leads to depression. And I think a lot of those patients, they feel depressed, a lot. And how often do you get a woman that's like, oh, well, we can't figure it out. Maybe it's fibromyalgia, but the medicines don't work here. Let's put you on an antidepressant. And they just blanket everybody with these antidepressants as if that's going to solve the problem. And it almost never does. And so now you're like, wait a minute, we can figure out why you're sick, and what are the things you can do, the steps to make sure you're not continuing to expose yourselves to the things that are causing your illness. And it's a huge advantage in my view. Do you so you are obviously in Florida, so you're licensed in Florida. Are you licensed in some other states too? Where do you typically see patients from?
I'm from Nebraska, so I'm licensed there as well.
Okay. Were you a volleyball player?
Yes.
You were. I was just guessing. Nebraska's got good volleyball.
Not at the college level, but yes.
Yeah.
Big fans.
I think it's
sure.
a big state. I think Nebraska big on volleyball, and I think wrestling for the guys. I mean, those are big.
Yep.
Iowa's a huge wrestling state. So,
yes.
Well, I'll tell you what, Joleen, thank you for doing this, and appreciate just you being part of Revero and bringing a positive attitude and making a difference, because this is what we're setting out to do. And hopefully as we continue to grow and scale, we'll be able to make a difference on a much larger scale. And you'll be part of that first wave of changing the way we do medicine, because I think we need to do that. I just think that's what that has to happen. Otherwise we're just going to go into this. Everybody, there's a pill for every ill, or as a surgeon, we say heal with steel. Because surgical steel, we're going to heal with steel, man, and just cut it open. That was my tool for many, many years, but it's not the best tool for every situation. So anyway, Joleen, thank you for doing that. If somebody, I don't know, do you have a social media or anything like that? Do you want to discuss or anything like that? If somebody wants to find you, follow you and stuff.
Just Joleen Lake on social media. Yeah. All
right. Well, I'll let you get back to your wonderful Florida afternoon. Enjoy I think, I don't know when the months, I mean, maybe from like October to May is a Florida time. And then
yes,
June, July, August, kind of rough, but still
beautiful.
Still beautiful out there. You watch the sunsets, because you're on that West Coast side. So I'm sure you have beautiful sunsets at night to check out. I'm sure.
Yes, we sure do. Thank you so much for having me. I really
likewise,
appreciate
Joel. Thanks for being part of Revero. Thank you. Have a wonderful, wonderful day.
Thank you. You too.